Hello, I'm hopeful that you had a good New Year's. Certainly, we in the healthcare industry welcomed it in with a bang. We have seen more volume than we could ever have imagined in our hospitals and throughout our entire system. We've seen many of you fall victim to COVID, and that's actually one of the reasons why I'm taping this way today, because my own videographer was exposed and we had to pivot to find a new way. So let's just start in big bold numbers, right? Yesterday, 25,000 cases in New Jersey were determined positive. Our transmission rate is 1.77. Remember, the goal is to be under 1. We have over 4,000 people in our hospitals, and we are seeing people coming in to the hospitals sicker and sicker. There's a huge demand for testing, and I certainly have heard from you very clearly on our social media, as well as stopping me in the grocery store and in church and telling me how frustrating it is not to get testing. The reality is that there is no way to be able to staff accordingly, given that the reality is, while you're sick in the community, because our staff live in the community, they're sick as well. So we are trying to pivot and move people and adjust as the situation requires. But at the end of the day, I hear your frustration and I am sorry for that. We continue to remain open with our vaccine tents, and you'll see the hours above. We continue to try and meet the demand of the vaccines and the booster, as well as trying to think about new ways to be able to address testing. I don't have any of those for you at this time, but we continue to understand how frustrated you are that you can't get in, and you have been very clear about that. The highest priority is that we have to keep our staff safe in order to be able to be available to care for patients. And if we can't care for you in the most difficult setting, which is our inpatient setting at this point, then the fabric of this entire healthcare system begins to fall apart. So we're going to continue to keep you apprised. The state's data tells us that the surge is going to be anywhere from 2 to 4 weeks away post the holiday time. And so while this is very bad and the worst that we've seen, it's not as bad as it's going to get. And so I'm going to ask for your patience. If the only thing you need is a test, do not come to the emergency rooms. We are absolutely full with people who are really sick, and we cannot provide testing out of there. If indeed you are really sick, come to the emergency room, but understand that we are working under red visitation, which means that they're only under limited circumstances are you going to be able to have a loved one with you. And that then translates off, obviously, into the hospital as well. I know this is scary. I know this is scary for you. It's scary for all of us as we begin to try and pivot yet again to react to this virus. But we will, because that is what we do, and that is our obligation to you and to our broader community. So one of the areas you've been clear about is your frustration around our urgent care centers, and we are having to pivot staffing based upon how many people are out ill, and our urgent care centers that are the busiest, trying to make sure we have enough staff there to accommodate the huge influx of people. So this is the list that we have today of our urgent care centers. Please note that we are going to have to close our busiest centers early, but 7 o'clock instead of 8 o'clock, just to deal with the huge demand to be able to accommodate everybody. You may also see some pivots within our physician practices within IMG. And again, I please urge you to make sure you're checking the website to be able to accommodate all of those changes. So today's patient story I want to talk to you about is a woman by the name of Linda Marple. Now, you would think that a fall down the stairs would not necessarily bring a letter to me that talked about all the positive things that happened. But Linda was so pleased with the experience that she had with our team at Mullica Hill that she didn't want the moment to go by without taking time to thank them personally for the work that they've done. See, Linda's son is a physician a few states away, and she wanted to make sure he was integrally involved. And the care team was able to integrate him and her at the same time as they were doing rounds and having those care conversations. And that gave her tremendous comfort. Not only the big thing, which would be how we delivered the care and what the plan of care was, but those smaller things, making sure that she had a cup of ice with her tea in the morning, because that was something that was important to her. It really allowed her to feel part of a bigger family. And that really is our goal here at Inspira. Both the big as well as the small is important to make sure that we get Linda and all of you back to your homes and back to your health that you want. And for Linda, part of her New Year's resolution is making sure she can get back to her scuba diving. In her 70s, she finds that that is one of her favorite hobbies. And we look forward to seeing more pictures of Linda, and we wish her well. And lastly, I just want to tell you, we were thrilled to welcome 3 new little girls into the world, one in each of our facilities, Vineland, Elmer, and Mullica Hill. We congratulate their parents and we welcome them to what we know is a brave, strong world, but certainly will be better with them in it. Until we meet again, be well and stay safe.